As you know, when I first found out that Damian had CP, I remember being in the neurologist's office and hearing those words for the first time. And when I left, I was basically in like shock, denial, I just remember having to walk. I was going to another doctor's appointment with him, and I couldn't talk to anybody because I had to get to that doctor's appointment. And I kind of didn't know how to process it, who to talk to. And I didn't want to tell anybody because I was afraid if I did, it would make it real. Like maybe if I didn't tell anybody, she could just be wrong. And we had been going to physical therapy with Damian because of his severe reflux. And so the pediatrician thought that the physical therapy would help with that, which it was. It was definitely helping. And it was the physical therapist that recommended us to go to see the neurologist because she felt something. And so I was going back to the same place where he was getting the physical therapy. And I didn't even want to tell them what she said. But I thought, let me tell them because I think what they'll say is, no, I think she's probably wrong. And I shared it, and you just saw this kind of look of, from the PT, well, now we have a confirmation, and, we kind of know which direction to go in.
So the PT actually had that suspicion in the beginning.
Correct.
And as a physical therapist, he or she didn't have the ability to share a diagnosis like that with you. That was just their suspicion from feeling the tension in his muscles and looking
Yes,
at his progress.
exactly. Just from so many years of seeing these kids every day, she
Mhm.
just recommended it. I remember her saying, I'm seeing some things, um, and I'm starting to think of what things might help him. You may want to consider special shoes. And all I kept thinking was, right, but we came for the physical therapy. He has some reflux. That's all it is.
Mhm.
And if you remember, Damien's reflux was severe. So he was literally just sleeping on us 24/7 because he could not sleep on his own
Mhm.
because he would choke.
Mhm.
Um, and, he had a very complicated birth. He was 2 pounds when he was born, as you remember, born 3 months early, resuscitated twice.
Mhm.
He did have exposure, drug exposure. Uh, and in the NICU, the nurses trained me of what to do if he would choke, that this was something that he had this problem even in the NICU. And they showed me this little blue syringe
Mhm.
and
Called the
what to
syringe.
do. And
Mhm.
I remember thinking, oh, I'm glad you're sharing this with me. I'm not going to have to worry about this. And the very first night, we had to stay in a hotel because we just adopted him. You couldn't leave the state. So he was sleeping in at the end of the bed in a bassinet. And all of a sudden started to see something happening. And I realized, oh my gosh, exactly what she described is happening. And so I got the blue syringe and I knew just what to do.
Mhm.
And I ended up having to do that. Like, I can't even count the amount of times. And then how many times I had to clear those passageways. And as he grew older, the Heimlich, the whole thing. So,
I
um,
remember you being here one time and, he was just sitting in the high chair and seemed totally fine. And then all of the sudden, he had an episode where, he looked like he was going to vomit, but he was also trying to breathe at the same time.
yes.
And Carter, my husband, who is an EMT, a nurse, myself, I'm a nurse practitioner. We've been trained in all kinds of emergency responding. And within a minute, like in our mind, we're like, oh, it seems like he's choking. Maybe we should do something. And before we could even process that thought, you were out of the chair, whipped him up, like kind of turned him over, cleared his airway, and then he was okay. But like you had, because it happened so much and so often, you were like, okay, it's all done. Like it just became part of your daily routine, like it was nothing.
But that's part of like, how did I get to want to do this podcast? When I got the news, and that was a long way of saying, like, when I got the news that he had CP, my first thought was, I wish I was my sister. Because, here you are, a nurse practitioner, and you specialize in pain management and all these amazing ways of helping people that have challenges. And here I am, an actor. Like, oh no, they picked the wrong person to be his mom. Like, oh no. I felt so unequipped. I felt so like, even if I wished I was a physical therapist or, something where I could give him everything he needed. And I just didn't know, where to go, what to do. And then you realize there is value in not knowing, because in being a person that doesn't know, it makes you seek out possibilities.
Mhm.
And so that really is what makes me want to share this information. Is this has been such an incredible journey over these past 3 years of learning so many different ways to help Damian. And to find that saying CP is okay and sharing with people that he has CP in a way that's not, no, he has CP. It's like he has cerebral palsy,
Mhm.
which I think I tell people constantly because they see his AFOs or they see him using the walker, and it's not like you can hide it.
Mhm.
So you're educating people, but then they're in turn educating you. The more I meet alternative therapists, um, I have just found my way to the most incredible people. And as I see Damian struggling or thriving, that's the information I want to share. And that's what's behind Damian's way, because every person's journey is going to be completely different. Um, just short example, when he first started wearing his AFOs and he hated them and he was crying. And I just Googled alternative to AFOs and found the ABM, a not Banyal method, And here was a whole new alternative way of him connecting with finding his balance and standing without the AFOs. And he still uses the AFOs, both are helpful, but it's just little things like that, which has just been very eye-opening.
So I just want to go back a little bit to what you said, when you said in that moment that you maybe wish that you were a nurse practitioner, like you wished you were me or a PT or OT. And all I can say is that watching you go from, the first day that you brought Damian home through this journey, you have grown as much as I have seen Damian grow and become such an inspiration, because he is truly inspiring. And I want to touch on a story that we'll talk about in a minute. But he brings inspiration every time that I share his story or I share his success or a mile marker that he's made. People are amazed, and he brings inspiration to people's, each and every day. And when I share his journey with other people, you are equally as inspiring, and you have grown in your knowledge and your confidence and your ability to navigate something that many people would have just thrown their hands up. So you are absolutely the right pick. God knew what he was doing when he assigned Damian to you and Greg, because without your motivation and your insight and your forward thinking, that you don't just settle for what someone tells you.
Thank you for that. Sometimes you don't always get that positive reinforcement back.
Mhm.
And I would say to, moms and dads and family members, your child, not that you shouldn't be open, but when they're pushing a certain way of doing what they do, right? For example, medication, you can see tremendous progress. I see it in Damian, where he went from, not being able to walk at all, just army crawling, to being able to stand, to being able to take a few steps with a walker, to now walking with a quad cane. And for the longest time, it was, you need to try this medication, this surgery, this medication, this surgery. And, I'm watching the unbelievable progress he's making in physical therapy, for example, and just going, but if we just wait, just wait, just wait. No, it's never going to work. You think it works, but it doesn't. You'll see if you use medication, it's going to make such a significant difference. Or if you do this surgery, and you have to weigh all things, you know. Um, so I think there are times where you may be the only one saying, but I see this is working, and I'm just going to be patient with what we're doing.
And what I hope people can pull from this podcast is that, the physician, yes, a neurologist has years and years of experience and years of medical school. And I don't want to take anything away from their expertise and their knowledge and their skill. And they probably have seen positive benefits, especially looking at children. So in their experience, they have seen what the medical textbooks have demonstrated, or what many research studies have demonstrated, that there is positive benefit to perhaps a medication, right? So they prescribe something like baclofen, and they can see in that short window of time, as a pediatric neurologist, right? They see in that short window of time that the children that come in, they prescribe baclofen, and within, a week, a month, 2 months, they're seeing improvement in the child's ability to walk. But I think what is missing from that picture is that, like you said, you're with them for 5-10 minutes in the office, and they also don't see the long-term effect. So I come at this from a perspective of being a pain management nurse practitioner and managing people who are on baclofen long-term. So I see adults very frequently with all different types of neurodegenerative issues, MS, CP, spina bifida, etc. Like, I see people with these conditions who have been on baclofen long term. And what I see is that someone who's been on baclofen from the time that they were 3 or 4, the dose of the medication needs to be increased. So yes, it may be helping. It's serving its purpose, and its purpose is to reduce the tension in the muscles, reduce that spasticity. And I don't disagree that it does that, but it doesn't just work on the one area where there might be that spasticity. So we've talked multiple times about Damian's biggest issue is that one foot, And so to give a medication to manage that spasticity in his one foot that will not only just work on that area, but affect his whole body. And then long term, he may need an implanted device that's filled on a monthly basis with that medication and a catheter that goes from that device into the spinal column to infuse the medication because that's the only way to continue that medicine. And
Exactly. And like,
right.
as a regular person, not a medical person, I see the left foot, right,
Mhm.
as causing the problem. But we know it's the whole left side,
Mhm.
and the foot is a symptom of other things not quite,
Mhm.
you know, working or connecting in his brain.
Right.
So I wanted to always find those ways to open up those connections and those pathways.
And so that's the other piece, right? So the medication only treats the symptom. The
Right.
medication doesn't treat the cause of the symptom. And I think that is sometimes a blind spot for healthcare practitioners because, as a nurse practitioner going through NP school, we are taught to prescribe medications that treat symptoms. And in an acute setting, you come to the hospital and you're having, you were just in a car accident. We need to treat that acute symptom. But when we take a step back and look at things from a long-term management point of view, it's just treating the symptom is not good enough. We need to backtrack and figure out what caused the symptom. And if we can intervene to try and help the reason that the person is having that symptom, like spasticity, then that helps the individual have a more productive, functional life long term and not being married to a medication for the rest of their lives.
Right.
Do you remember when we were out with mom? We had just so for our listeners, because we talk because we know our mom. We love our mom to death. Our mom is 79 years old and she has MS. And we had taken a road trip with Damian to Delaware to bring our mom to a neurology appointment. And so we had gone to the neurologist, and then we were bringing our mom back to New York with us. And we had to stop at Walmart because she needed a few things for the trip. And as we got into Walmart, she was insistent that she needed Pepto-Bismol because she had some indigestion in her belly. And
And
as a
she says it just like that.
yeah,
Pepto-Bismol.
Pepto-Bismol. And we counsel her on a routine basis that any type of medication that's used to treat, acid reflux is not the answer, that you need to get to the root of the problem. But
But we
she
want to be careful in case Pepto-Bismol wants to be our sponsor. So I just want to acknowledge that it does work in a pinch.
yes, in a pinch. But I'm sure if you read the bottle, it does not say use for more than X number of
Every
doses.
single day.
Every single day, sitting next to your chair without even measuring it, she takes a big slug
That's our
several
mom.
times per day. So I digress. So we had informed her that we were not going to buy that for her and that if she wanted it, she had to go get it herself. And so she took off on her electric scooter to go get the Pepto-Bismol. And we went shopping, to get the other things that we needed for our road trip.
And we're looking for Nana still. So we have Damian, in tow.
So Damian's walking with
Going, Nana, Nana.
Damian's walking with his racing blue walker. I love to color up his walker. It's this bright electric blue. And he is flying, loving running around Walmart because it's like a big open space and he's weaving in between all the clothes. And because we had sent her off to go find her Pepto-Bismol if she was going to get it for herself, we kind of realized we needed to find her. So we said to Damian, we're trying to find Nana. So he's racing around Walmart looking for her. And as we're coming around a corner, there's this other mom with a small child who, I don't know, maybe he was about 18 months, maybe
Maybe a little bit older, I think, in the wagon.
shopping cart.
Yeah. And
And
she just stopped us and said, "Oh my gosh. Yeah, your child, your child's amazing."
and she wanted to know. She said, why does he need the walker?
Yes.
Right. And
And
so
so I explained that Damien has cerebral palsy, and she had shared that I think she had a similar experience where she was told that her child may need a walker at some point, and she was very, adamant that no, if he uses the walker, he's not going to walk. So I don't want to give I don't want to give in. I don't want that. And with that, it was also, and they told me that my child should learn sign language, and I said no, because if he learns the sign language, then he's not going to want to talk. And I was able to, as a mom, some of those same thoughts came across my head in the beginning, and to share, no, actually, the walker has been amazing for Damien. It is a bridge, it is a tool. He's able to explore on his own, he can participate in things. And the sign language too has been unbelievable. I'm able to communicate with him, he's able to communicate with others. And she just remarked, on how happy he looks.
Mhm.
And as somebody who was so afraid to have her child use a walker, it was, oh, I can see that it's not this, like, I think people can get an image in their head of what it's going to look like, what cerebral palsy looks like. If that child is using a walker, are they going to be, down, or whatever. And to see Damien like running through Walmart, screaming Nana, laughing and giggling, it opened up a new picture. And the same with the sign language, I would say as well, that I can understand what he's trying to say because of ASL, which has helped him so much. He's starting to say some words now, but that ability of his brain to make connections using the ASL has only helped his speech. It hasn't, there's a great saying in Anat Banyal method, if he could, he would. Walking is much easier than using a walker. So when he gets the ability to walk, he's going to choose to walk over depending on the walker. The same with speech. It's if he could speak, he would just start speaking now.
Mhm.
It's not like either or,
Yeah,
one helps the other.
absolutely. So, what we went on to explain to her, especially with the sign language, is that, sign language utilizes both the part of the brain that comprehends speech, that comprehends ideas, that helps you devise what you want to convey to someone else. And it activates the motor area of the brain because you need to learn, right? So in order to, sign, I've got to go to the bathroom, or I want, or milk, or pizza.
Damian, do you want to talk to
You're
Grandma?
using your hands, you're
Yes?
using your motor
do?
capacity to
You want to talk
help
to
you
Grandma?
convey a message.
Okay.
And it is so just as I think it's important for the listeners to know, my daughter is a ASL interpreter. So she's a certified interpreter. And my amazing soon-to-be son-in-law is deaf. And so I have learned so much from Kaylee and Joey, just from, learning. So prior to being exposed to the deaf community and, people learning sign language, I didn't know anything about it. So I would have never realized the value and the benefit of ASL outside of people who are deaf. And, I think part of the common factor is, my daughter Kaylee talks all the time about children who are denied access to communication. So children who are born deaf and perhaps they're not taught sign, their family doesn't learn sign, and or someone who's deaf and they go someplace where there's no access to have someone either sign for them or have some other alternative. And when you lack access to communication, people become very frustrated because you're not able to communicate. So children who can't articulate, maybe they can hear, right? Like Damian, he can hear, he knows everything that's going on, but not being able to convey what he wants or what he needs for his safety and his happiness can be very frustrating. So this gives another tool to help him grow and build those areas of the brain that help with communication. And we've also talked about the use of the iPad, that it would be super easy to just hand him an iPad and have him, touch what he wants on the iPad. But that's a tool, right? So the ASL is a tool, the iPad is a tool. These are all tools that allow him to grow and develop and build those areas of the brain that maybe at some point, he may not need them, but he will always have them. Once you teach someone a skill and they develop that skill and incorporate it into their life, they always have it.
Exactly. I mean, I'm learning too with the iPad how his sentence structure is growing with that. With school, because he has to put the sentences together. And so the iPad was another sort of fear of mine. I think all tools are helpful. Just the iPad can be limiting. Just, not using the iPad too, right? But all of these things, like you said, are tools. And so anyway, this mom literally just hugged us in the middle of Walmart and was very emotional because she had just gotten a diagnosis. I think it was not that long, before she was in that Walmart and felt like I did. Like, I don't want to tell anybody because that makes it real. It's all those same thoughts. It's, if I don't talk about it, maybe it won't be. Or if they don't use a walker, then maybe they won't need the walker. Or, and I think people get images in their mind of what does it mean now that I have this label of cerebral palsy. Mm-hmm. And then you look at Damian and you go, oh, he's so happy. It's not so scary. Mm-hmm. And because of Damian, I think that day, that mom just felt a little bit more relieved because she saw what was possible, that her child can be happy. Mm-hmm. And no one thing is going to work or not work. And the tools that she was coached to try looked a little bit easier than she had anticipated just by seeing him using them and running around Walmart looking for Nana, who was in a scooter.
So ultimately, we did find her and she did not buy the Pepto-Bismol.
Yeah.
But I think when we were in the car after leaving Walmart, that's when it really hit home, to me, that this was something we had to do, because just seeing the relief on that mom's face, having her hug you, having her share how scared she was before she spoke to you, and that she did have hope, and that, she felt like, okay, I think I can do this.
And I'm still scared. I mean, that's what this is too, right? It's like, I love that I can meet with you every week and talk about what's working and not working.
Mm,
And then why not share that information?
right.
And
Because
it,
you don't know what you don't know.
right. And I'm grateful to you that, I have you in my life, and that as a nurse, I can share these things with you and then say, and like this brain connection thing. And then you can say, oh, are you talking about the whatever,
Neuroplasticity.
neuroplasticity, which I've read every book I could find on it.
Mm,
And there aren't enough, I'll say that,
mm,
especially when it comes to children. And that's the other thing I'm learning, which you shared with me, there's not as much funding for research for children.
mm.
And so there isn't as many books and as many studies. I find a lot of books for adults, and I try to read those and translate how they can work for kids too, you know.
But children are not little adults.
Yes.
Children are unique. And there are things about children that do not, things about adults that don't translate into what you would do for someone who's a child.
It's very true. Just trying to learn more about the nervous system, for
Mm,
example, and, finding a lot of books on the nervous system. The things I can pull out are like foods good for the nervous system, and
mm.
then what I've done is just every food I found, just buy it and I put it all in a smoothie for him because it's not going to hurt him. If
Right.
it's sweet potatoes and avocado and what else is good? Cherries, for the nervous system.
Very,
And it's like, oh, now I've made a sweet potato avocado cherry smoothie.
but it actually tastes
And
good.
sometimes Damian's like, what is
So, I think the other part of the goal behind this podcast is to also, help us, right? So, like, just exploring what's out there. And then as we explore and talk and maybe look at where is research going, and who are the experts. So, we hope to pull in different people who have not only helped Damian directly, but over time, perhaps as we're learning and growing, pulling in other people that maybe could answer questions for us, or maybe to find solutions to different things. And the strategies that you have used for him to gain the resources that you need, because that's the other piece, right? A lot of the things that are helpful are not easily accessible.
Yes. You learn about them from other moms or, and I think the other thing that I'd like to share is, you're always looking for that one thing that you're going to do. And then you have all these videos out there of like, we did this therapy and now look, and all of a sudden you see this video of the child walking for the first time. And I would watch those at nauseum, at night, and just cry, imagining the moment he walks. And one of his therapists shared the most insightful thing I've ever heard, which was, is the goal walking, or is the goal joy of movement? And I think that was such a significant piece of information, how to look at it. Because we're all looking for that one thing, and it isn't that. It's, our journey has been, we try everything and we see tiny little moments of movement here or a new skill there. And sort of leaning into that, I think, makes the journey what it should be. It's Damian's way. It's not like, I'm going to find this one thing and all of a sudden Damian's going to start walking and it's going to be this incredible thing. And, it's just not like that for us anyway.
And I think that is true for most things, right? So, sometimes we have an epiphany, or sometimes there's this moment where things come together. But what we're missing out on is what led to that. What led to your epiphany? Well, usually there's many different thoughts and ideas, and you've contemplated things. And then after all of that, then this moment of clarity occurs. Or when you're learning something, right? Even when children who do not have CP learn how to walk, they don't just get up and walk.
Right.
Right. First they crawl, and then they cruise on the furniture, and then they might take a step and fall, and then they decide not to even try that for a little while, and then they gain their confidence again. It doesn't just happen overnight. And so any journey to something that is, when you're going towards a destination, and life really isn't about a destination, it's about that journey. It's about what you learn and develop and grow along the way. And it never is one specific thing, one medicine, one food, one therapy, because our bodies are so complex and there are so many different things at work at the same time that allows our bodies to do what they need to do. So the thought that one specific medicine or one food or one therapy or one anything is going to solve the problem or improve the situation is, it's not realistic, and it's not how we're meant to be.